Now we will discuss the basics of the ECG. ECG is the graphical representation of depolarization and repolarization of cardiac chambers. Coming to the history, it was the Augustus Waller in 1887 who first recorded the electrical activity in human heart. He was a British physiologist. Who first recorded electrical activity in human heart. In 1897, Dr. William Einthoven developed 3-lead ECG. Using string galvanometer. So, in 1897, Dr. William Einthoven developed 3-lead ECG using string galvanometer. He used or coined the term EKG. And he used PQRST and labeled them in ECG waves. So, William Einthoven coined the term EKG and he used PQRST as a labeling for the ECG waves. William Einthoven has been awarded with Nobel Prize in 1924. William Einthoven has been awarded with Nobel Prize in 1924. Dr. Frank Wilson developed a central terminal to record precordial leads. So, Dr. Frank Wilson from the University of Michigan he developed a central terminal to record precordial leads. After that, Dr. Frank Wilson worked or developed in between 1900. Frank Wilson developed central terminal to develop precordial leads in between 1934 to 1938. In 1942, Goldberger modified these precordial leads into augmented limb leads. So, these are the basic of the history of ECG. So, we are recording ECG for various purposes, like to detect conductive abnormalities of the heart, like to detect chamber hypertrophy, to detect ischemia. There are various disorders to detect rhythm disorders. So, there are various aspects in recording for the ECG to note various diseases of the heart. So, coming to the recording of the paper of the ECG. So, this is the standard ECG paper we are using in our day to day routine life. So, the ECG paper have large squares and small squares in between that. So, that each large square is around 5 mm and each small square is 1 mm. Each small square is 1 mm, each large square is 5 mm. In the x axis, time has been calibrated, in the y axis, millivolt has been calibrated. In the x axis, each small square is 0.04 second, and in the y axis, each small square is 0.1 millivolt. Okay. So, if each small square is 0.04 second, then 5 small square is 0.04 into 5, 0.2 second. Okay. So, if one large square is 0.2 second, 5 large square is 0.2 into 5, which accounts to 1 second. So, 5 large squares corresponds to 1 second. So, what is the net distance of this 5 small square? Each large square, what is the distance of 5 large square? Each large square is 5 mm. So, 5 large square is 5 into 5 is 25 mm. Okay. So, the 5 large square is 25 mm. If we calibrate time, it is 1 second. So, what is the speed of that ECG paper? 25 mm per second. It is the standard calibration. So, it is the standard calibration in x axis. If you calculate in y axis, each small square is 0.1 millivolt. So, 5 small square is 0.5 millivolt, and 10 small square is 1 millivolt. If you calculate 10 small square, okay. So 10 small square is 10 mm, because each small square is 1 mm. So 10 mm per 1 millivolt, or in other words 1 millivolt per 10 mm. This is the standard calibration in y axis. So the ECG paper speed is 25 mm per second. We can change the ECG paper speed of multiples of 25. So we can change it to 25 into 2, 50 mm per second, change to 12.5 mm. Okay. So this is all about basics of ECG. In the next session we will discuss regarding different waves, its calibration, and how we will appreciate the different precordial leads and limb leads.